Hi everyone, a blessed day to all of you. Praying that all of you are safe and doing well together with your families and loved ones. I'm hoping that all of you are doing and giving your best in your study. Okay, so in this video presentation, I'll talk about cancer. So we'll discuss cancer in general. Before proceeding with our discussion, let me again present to you these disclaimer slides. So this is the outline of this presentation. So first, we will discuss about pathophysiology of cancer, and then we'll talk about proliferative patterns. Next is the detection and prevention of cancer and the diagnosis of cancer. So those are only the topics that will be discussed in this presentation. The term cancer is actually not a new term to us. So we've heard this term from our friends, relatives, classmates, co-workers, and etc. Because this is one of the killer in our times, diba? Ito yung usual cause of death in our time. So cancer is a complex of diseases which occurs when the normal cells mutate into abnormal cells that take over the normal tissue and eventually harming and destroying the host. And it has a multi-system effects, meaning it could involve all body organs. And there are different classifications of cancer. There are solid tumors and hematological cancer. Actually, cancer is a large group of disorders with different causes, manifestations, treatments, and prognosis. Because cancer can involve any organ system, and therefore, treatment approaches have the potential for multi-system effects. So cancer nursing practice overlaps with numerous nursing specialties. So iba-iba ang ating nursing specialties, particularly in giving or managing cancer patients. During the lifespan, various body tissues normally undergo periods of rapid or proliferative growth that must be distinguished from malignant growth activity. So there are several patterns of cell growth that exist, and these are the neoplasia, anaplasia, metaplasia, hyperplasia, dysplasia. Okay. So, talking about neoplasia, this refers to uncontrolled cell growth that follows no physiologic demand, while anaplasia refers to the cells that lack normal cellular characteristics and differ in shape and organization. Metaplasia, on the other hand, refers to conversion of one type of mature cell into another, and this is usually reversible. Okay, so dysplasia refers to bizarre cell growth that results in cells that differ in size, shape, or arrangement from other cells of the same type. While hypoplasia refers to incomplete or underdevelopment with decreased number of cells. By the way, dysplasia actually refers to early neoplastic process. And hyperplasia refers to increase in the number of cells. This may be hormonally induced. Cancer can strike at any age. Hindi siya namimili kung bata ka, matanda. Okay? So actually, cancer is a second to cardiovascular disease as a cause of death in the United States. In 2015, nearly 700,000 new cancer cases were diagnosed in America. And in the same year, in 2015, nearly 600,000 Americans died as a result of cancer. So despite of significant advances in science and technology, still cancer is the second leading cause of death in the United States, as mentioned. And currently, 1 in 4 deaths is caused by cancer. So, cancer usually, or the common cancer that affect men are prostate, lung, and colon and rectum. While the common cancer that affect women are breast, lung, and colon, and also rectum. So the overall, the incidence of cancer is higher in men than in women in the United States. So you might be wondering what really causes cancers. So still, it is unknown. However, there are factors implicated or known to induce carcinogenesis that includes bacteria or viruses, physical agents or some chemical agents, could be radiation, could be genetic or familial factors. Actually, lifestyle factors and hormones can also cause cancer. However, additional research is still needed for a better understanding of the relationship between the etiologic factors and the cancer. As mentioned in the previous slides, these are the etiology factors implicated or known to induce carcinogenesis. The first one is viruses and bacteria. So it is estimated that about 11% of all cancers worldwide are linked to viral infections. That's according to the study of Schiller and Lowley in 2014. After infecting individuals, the DNA viruses insert a part of their own DNA near the infected cell genes, causing cell division. The newly formed cells that now carry the viral DNA lack normal controls on growth. And examples of these viruses that are known to cause cancer include human papillomavirus or HPV that can cause cervical, head, and neck cancers. Another one is hepatitis B virus or HBV that can cause liver cancer. Another example is the Epstein-Barr virus or the EBV that can cause Burkitt lymphoma and nasopharyngeal cancer. So for physical agents, example of this are exposure to sunlight without using sunscreen, exposure to radiation or chronic irritation or inflammation, exposure to tobacco carcinogens, and exposure to industrial and chemical and asbestos that can cause skin cancer. For the chemical agents, we have again exposure to tobacco smoke, okay, even the secondhand smoke can also cause cancer. Genetic or familial, usually it runs in the family because they share the same genes, environment, and cultural factors, or they share the same lifestyle. And another factors that might cause cancer is the lifestyle factors, especially yung dietary factors natin, such as diet, obesity, and insufficient physical activity. Okay, it can be proactive or can be carcinogenic or co-carcinogenic. Eating fatty food, ano pa ba? Alcohol, salt-cured, nitrate-containing foods, red and processed meat are examples no, under your lifestyle factors, and the hormonal agents. So, hormonal changes related to the female reproductive cycle are also associated with cancer incidence. For example, early onset of menses before age of 12 and delayed onset of menopause after age 55, or null parity or never giving birth and delayed childbirth after age of 30, they are all associated with an increase of breast cancer. So, girls, dapat magkaanak na kayo before 30 ha, para hindi kayo magkaroon ng risk of developing breast cancer. Alright. Cancer incidence and death rates also vary by geography. So, as you can see in this picture, so in this population-based study, so there is a particular cancer that is higher, or there is a high incidence of a particular cancer in one country. For example, in United Kingdom, there is a high incidence of lung cancer. This is probably due to smoking, or maybe smoking is common in their country. Okay, in China, there is a high incidence of liver cancer. In Australia, skin cancer. In Japan, stomach cancer. While in US, colon cancer. In Canada, the dominant cancer is leukemia, while in Brazil, cervical cancer. So again, this type of cancer depends on the lifestyle or on the factors that we had discussed in the previous slides. So now let's take a look about cancer in the Philippines. We know that cancer is one of the most common causes of death all around the world. It affects, again, both men and women across all ages. And of course, even in the Philippines, it also happened. So actually, in the data of the Philippine Health Statistics in 2009, cancer is the third leading cause of morbidity and mortality in our country after diseases of the heart and the vascular system. So among Filipino men, the 6 most common sites of cancer diagnosed in 2010 were lung, liver, colon or rectum, prostate, stomach, and leukemia. Okay. So, bakit nga ba lang? Diba? Because marami sa atin ang smoker. Tapos, napaka-polluted ang ating country. Marami din sa atin ang mga, diba? Common sa atin yung pag-iinom. Kahit nasa kanto kayo, nakikita nyo yung nag-iinuman. Our diet, mahilig tayo sa fatty food. Yan, etc. Among Filipino women, the 6 most common sites diagnosed were breast, cervix, lung, colon or rectum, ovary, and liver. 189 of every 100,000 Filipinos are afflicted with cancer, while 4 Filipinos die of cancer every hour, or 96 cancer patients every day. That's according to the study conducted by the University of the Philippines Institute of Human Genetics, National Institutes of Health. As mentioned in the previous slides, the main etiology factors implicated or known to cause cancer are the following: the chemicals, the viruses, radiations, and heredity or the genes. Okay, so again, it is estimated about 11% of all cancers worldwide are linked to viral infections. Okay. So after an individual got infected with the viruses, then the DNA viruses insert a part of their own DNA near the infected cell genes that cause a cell division, abnormal cell division. And then these newly formed cells now carry the viral DNA. They lack normal controls on growth. So there are many cancers that are thought to be related to environmental factors or the chemicals or radiations. The most hazardous chemicals produce their toxic effects by alternating the DNA structure. This can occur in the body site distant from that of initial chemical exposure. An example of this again is exposure to tobacco. There is also an evidence that the passive smoke may be linked with childhood leukemia and cancers of the larynx, pharynx, brain, bladder, rectum, stomach, and breast. So this is what happened when the virus infect an individual. So the virus inserts and changes genes for cell growth, and then ayan, dumadami na yung kanyang uncontrolled na yung pag-grow ng mga abnormal cells. So tobacco use and cancer. Some cancer-causing chemicals in tobacco smoke. So those are the chemicals, no? Na kapag nag-smoke kayo, napakaraming chemicals that can cause cancer. There are different types of cancers, and naming cancers depends on their location. So those are the cancer prefixes point to location. So those are the prefix and their meaning. So when we say adeno, it refers to the gland. Chondro, meaning it could involve the cartilage. Erythro, red blood cells. Hemango refers to the blood vessels. Hepato refers to liver. Lipo, referring to the fats. Lympho refers to lymphocytes. Melano refers to pigment cell. Myelo refers to bone marrow. Myo refers to muscle, and osteo refers to bone. Let us now proceed to the pathophysiology of cancer. So cancer is a disease process that begins when a cell is transformed by genetic mutations of the cellular deoxyribonucleic acid, or the DNA. Genetic mutations may be inherited and or acquired, leading to abnormal cell behavior. The initial genetically altered cell forms a clone and begins to proliferate abnormally, evading the normal intracellular and extracellular growth regulating processes or signals, as well as the immune system defense mechanisms of the body. These genetic mutations may lead to abnormalities in cells signaling transduction processes or signals from outside and within the cells that turn the cell activities either on or off. That can in turn lead to cancer development. Ultimately, cells acquire a variety of capabilities that allow them to invade the surrounding tissues and or gain access to the lymph and the blood vessels, which carry the cells to other areas of the body, resulting in metastasis or spread of the cancer that can occur again when these abnormal cells invade other tissues. So the cancer development is linked to immune system failure. Example of clients susceptible to developing cancer. To discuss further the pathophysiology of cancer. Again, cancer is a disease that is characterized by DNA damage that causes abnormal cell growth and development. Actually, the pathophysiology of cancer involves three processes. These are the initiation, the promotion, and progression. Okay. During initiation, the damage or mutation of DNA causes excessive cell division because we have excessive oncogene function but decreased suppressor gene function. During promotion naman, mutated cells are exposed to promoters that are known as co-carcinogens, pro-carcinogens, that enhance their growth. An example of this is estrogen that can promote the growth of the certain type of cancer. And the third process or the third stage is the progression. During this stage, the tumor cells acquired additional mutation and their growth rate increases that allow them to metastasize or spread throughout the body and makes them resistant to therapy. So these are the general signs and symptoms of cancer. When we say general, to all types of cancer. First is unexplained weight loss, meaning kahit hindi ka naman nagda-diet. Okay. There is fatigue, pain, infection, and bleeding. So now let's talk about how cancer can be detected, how to prevent, and how to diagnose cancer. So for detection and prevention of cancer, we have primary prevention, secondary prevention, and tertiary prevention. As a nurse, in all settings, we play a key role in cancer detection and prevention. So it is very important for us to have our clinical eyes and good assessment skills that you've learned during your health assessment. Okay. This primary, secondary, and tertiary prevention of cancer are all important. So talking about the primary prevention is about reducing the risk of disease through health promotion and risk reduction strategies. So your knowledge about your nutrition that you've learned during your NDT or nutrition and diet therapy is very important because you can share your knowledge about eating healthy to your patient and doing physical activity for cancer prevention. So another example of primary prevention is the use of immunization to reduce the risk of cancer through prevention of infections associated with cancer. Ano nga ba ang vaccine na meron tayo ngayon? We have the HPV vaccine, which is recommended to prevent cervical, head, and neck cancers. So we also have HBV vaccine to prevent the risk of hepatitis or developing liver cancer. For secondary prevention, it involves screenings and early detection activities that seek to identify precancerous lesions and early-stage cancer in individuals who lack signs and symptoms of cancer. So we know that detection of cancer at an early stage may reduce the cost, the use of resources, and the morbidity associated with advanced cancer. So, tertiary prevention focus on monitoring for and preventing recurrence of the primary cancer as well as screening for the development of second malignant or second malignancies in cancer survivor. So I hope this is very clear to you. Again, during primary prevention, mga health promotion po yan. Secondary prevention, pwede natin i-apply yung inyong health assessment. Tertiary prevention, ibig sabihin meron na itong infected na or affected na yung patient with cancer, diagnosed na yung patient. So we are preventing the development of second malignancies of those cancer survivors. Okay, so I just want to emphasize more on the prevention and detection. Again, for primary prevention, this is reducing modifiable risk factors in the external and internal environment. So another explanation for secondary prevention, this is recognizing the early signs and symptoms and seeking prompt treatment or prompt intervention to halt the cancerous process. For tertiary prevention, again, as mentioned, your focus is for monitoring and preventing the recurrence of the primary cancers. So, just another image of how to prevent cancer. Of course, you have to shield yourselves, your loved ones. Again, carcinogenic chemicals, carcinogenic radiations, cancer viruses, or bacteria. Of course, avoid exposure to sunlight, etc. So you have to avoid smoking because we know that tobacco is a carcinogen, diba? That can cause lung cancer. So this image just show you your risk of developing lung cancer. So if you are a smoker and you smoke 15 cigarettes per day, so you have almost 10 times of developing lung cancer. And if you are smoking more than 30 cigarettes or sticks per day, your risk of developing cancer is 15 times. So make sure to protect yourself from excessive sunlight. You can bring your umbrella or you can use sunscreen if you go swimming, or if you do gardening, you have to wear clothes that can protect your body. No? Lalo na yung mga nagfa-farm, no? Dapat nakasuot po tayo ng hat, nakasuot tayo ng long sleeve, long pants. So these are just example of skin cancers. Okay, so you have to make sure to limit your alcohol and tobacco intake. So this image show an example of a combination of alcohol and cigarettes increase risk for cancer of the esophagus. So if you combination ito, no, if you drink 4 times a day, yan, 4 times a day plus 2 packs of cigarettes that you consume per day. So meaning you are 40 times or almost 40 times risk for developing cancer of the esophagus. So to prevent from again developing cancer, of course, diet or the lifestyle is very important, the nutrition. So you have to consume fruits and vegetables, at least 1 cup of fruits and vegetables per day. Of course, to avoid cancer viruses, we should avoid unprotected and multiple sexual partners. Okay, so these are just an image of human papillomavirus infection increases the risk for cervical cancer. So there is a high incidence of cervical cancer risk for women infected with HPV. And of course, there is a low risk of developing cervical cancer for women non-infected with HPV virus. So these are the warning signs of cancer that one should watch for. So it is abbreviated as caution or meaning warning. So for letter C means a change in bowel or bladder habits. Okay, kung before everyday ka dumudumi, ngayon baka once a week or more than a week na, so wala ka pa rin BM or bowel movement. Or yung bladder habits mo, nahirapan kang umihi. Okay, so that's alarming already. Or there is a sore that doesn't heal. Unusual bleeding or discharge kahit hindi naman time or di ba once in a month lang tayo nagkakaroon ng menstruation. Okay, baka nagkaroon ka ng twice a month na bleeding or more than 7 days a week na sobrang puno ang iyong pads. There is a thickening or lump usually in the breast, no? Yan. Indigestion or dysphagia. Yan. Sa esophagus naman natin, baka may problem or sa stomach. There is an obvious change in a wart or mole. And there is a nagging cough or hoarseness. Okay, watch for your lungs. Okay. So, for patient with suspected cancer, you have to determine the presence and extent of cancer, and you have to identify possible disease metastasis. Okay, and then evaluate the function of involved and uninvolved body systems and the organs, and then of course obtain tissue and cells for analysis, including evaluation of tumor stage and grade. So moving on to diagnostic evaluation. So first we have a review of systems, physical examination. So alam po ninyo ito of how to do this because tinuruan na kayo during your HA or health assessment subject. Imaging like MRI or X-ray, laboratory test of blood, urine, and other body fluids. Or it could be a procedures or a surgical procedure, and pathology analysis, for example, biopsy. And those are diagnostic evaluation of cancer. So some cancer or early cancer may not have any symptoms. That's why mas maganda yung we have to check, no? If you're a woman, you have to do your breast self-examination. Kasi yung iba, hindi mo napapansin. Hindi mo, pag nakapa mo na yung lump, sometimes late stage na. So it's better na you have to do your breast self-examination. Okay? So early detection is very important for good prognosis. So those are example. For the site, example for the breast, of course, usually ang common affected nito are the female. Of course, there are also incidents, no, na may mga male din na nagkaroon ng breast cancer. So, importante rin tingnan or observe din kapag meron kayong lump na naramdaman, boys. Okay? For evaluation, importante you have to start, no, especially when you are 20 years old to 39 years old. So, clinical breast examination is very important to do it every 3 years if you are 20 to 30 years old. Ibig sabihin ng clinical breast examination, this involves, pwedeng kasama na dito yung pagpa-check up with the doctor, doing ultrasound, yan. And then, self-breast examination, you have to do it every month. Okay. Mas magandang gawin mo to on the first week of your menstruation. Yan. Evaluation for more than 40 years old, yung clinical breast examination should be conducted every year. And then for the self-breast examination, it should be every month. For early detection of colon cancer, especially for male and female who are more than 50 years old, it is important to have fecal occult blood test and flexible sigmoidoscopy every 5 years, colonoscopy every 10 years, or barium enema every 5 years. To detect prostate cancer, especially for male who are more than 50 years old or those male between 40 to 45 years who are high risk for developing prostate cancer. Ibig sabihin, high risk sila because they have immediate relative member or halimbawa yung dad nila or brother ay nagkaroon ng prostate cancer. So they are high risk. So it is important to have a prostate-specific antigen test or digital rectal exam every year. For early detection of cervical cancer, especially for female who are more than 21 years or within 3 years after starting to have intercourse, it is important to have pap smear test every year if regular pap smear, or every 2 years if liquid pap test, or can have pelvic exam every year. So for any cancer-related checkups, especially for male or female who are more than 20 to 39 years old, it is important to have exams for thyroid, testicles, ovaries, lymph nodes, oral cavity, and skin, counseling, health precautions, and risk factors every 3 years. And of course, evaluation for those who are more than 40 years should be every year. So to continue with our early detection, especially for female, it is important to have mammography, or this refers to radiologic study of the soft tissue of the breast to evaluate differences in the density of tissue, especially small or poorly defined masses or nodules that are capable of detecting breast cancers that are too small to be palpated on physical examination. So another test for female is Papa Nicolau smear or pap smear, which is a microscopic examination of the cells collected from the vaginal pool or exocervix and endocervix. For digital rectal exam, this is done annually on clients over 40 years old, and tumor markers, it is made by the tumor or the body in response to the tumor. So we have the following tumor markers. We have alpha fetoprotein, or your AFP, which is used to detect liver cancer or hepatocellular carcinoma or testicular cancers. And we have a bladder tumor antigen, or the BTA, to detect bladder cancer. And we have CA15-3, CA27.29 to detect breast cancer. And we have CA125 to detect epithelial ovarian cancers. Those are, again, the tumor markers. To continue with our tumor markers, we have carcinoembryonic antigen, or your CEA, which is used to detect colorectal and liver cancer. Estrogen receptors or progesterone receptors to detect breast cancer, and human chorionic gonadotropin, or HCG, to detect choriocarcinoma, testicular, and ovarian cancers, or your germ cell tumors. Again, your PSA, or the prostate specific antigen, to detect prostate cancer. Okay, to continue with our early detection, so we have imaging, nuclear med imaging. This can be through oral or IV radioisotope, followed by imaging. We also have PET scan, which use of a tracer or black and white or color-coded images. We also have PET fusion, or PET scan and CT scan in one machine to provide an image combining anatomic detail and functional metabolic abnormalities. And we have here biopsy, which is actually the gold standard for diagnosing cancer. So biopsy is a diagnostic surgery wherein we have to obtain tissue sample. There are different kinds of biopsy. We have incisional biopsy, wherein only part of neoplasm is removed and examined under microscope. And we have excisional or total biopsy, wherein the entire tumor is removed and examined under microscope. And we also have the fine needle aspiration biopsy, or known as the FNOB. This is done through aspiration of secretions from suspicious nodule and examination under microscope. And we also have sentinel lymph node biopsy, or SLNP. So again, this is how the biopsy is conducted, wherein kumukuha ng tissue from the patient or patient's tissue sample or blood sample. Okay, and then we'll bring to the laboratory to check for the pathology, proteomic profile, and genomic profile. Yung i-check nila. So we also have bone marrow biopsy, which is done by means of bone marrow aspiration, or uses a trocar or bone marrow needle. So the sites of aspirations are the sternum or iliac crest, which is the most common, and the tibia. So now again, let's go back of what really happens, kung bakit nagkakaroon ng cancer. Okay, so this is the normal cell and the cancer cell. Okay, during oncogenesis, which is the complex and multi-step process wherein these normal cells turn into cancerous cells, that leads to growth of cancer in the body. So, yung normal, nakikita natin kung ano yung itsura niya. So, itong damage na, or mutate, or damage oncogene, this is what happens. So, mabilis yung kanyang pag-grow. So this is just another image of what happened during when there is a loss of normal growth control. Ayan, ito yung normal cell division. Okay, when the cell damage, there is no repair, or there is what we call cell suicide or apoptosis. While in the cancer cell division, yan, ito yung first mutation, second mutation, nagdodoble, third mutation, nagiging 3 na yon, hanggang fourth mutation, layered na siya, hanggang sa dumami na siya, uncontrolled growth na damaging the host. So, how cancer invade and metastasis? The first one, the cancer cells invade the surrounding tissues and the blood vessels. And then the cancer cells are transported by the circulatory system to the distant sites. And then these cancer cells re-invade and grow at a new location. This is what happened kung bakit, halimbawa, breast cancer lang, pwede siyang lumipat sa lungs or other organs. So there are 3 stages of metastasis. You have invasion, spread, and establishment and growth. During invasion, the neoplastic cells from primary tumor invade into the surrounding tissue with penetration of the blood or the lymph node. And then the tumor cells spread through the lymph or circulation by or direct expansion. And then these tumor cells are established and grow in secondary site like lymph nodes or in organs from venous circulation. So you also heard about a mass, no, na chine-check natin if it is benign and malignant neoplasm. So we have to differentiate benign and malignant. So when we say benign, it is similar to cell of origin, and it is encapsulated, compresses, and then slow growth rate. Ibig sabihin, hindi siya lumalaki. And it seldom recur after removal. Kapag tinanggal siya, hindi siya bumabalik. Necrosis and ulceration is unusual, and there is an unusual systemic effects. So, benign tumors actually start from the suffix "oma", which is actually used to define benign tumors like adipose tissue. Naririnig yung lipoma lang yan. Bone or osteoma, muscle or myoma. Usually, ang myoma is in the uterine, diba? Uterus. Blood vessels, angioma. Fibrous tissue, fibroma. Those are benign tumors. On the other hand, malignant tumors are usually dissimilar from cell of origin. They have irregular edges and they usually invades other tissues. And it has rapid growth rate, mabilis itong lumaki. For example, may nakitang breast mass or na ino-observe, mabilis ang paglaki nito. Okay, moderate to marked vascularity, frequently recur after removal, and there is a necrosis and ulceration, and it has systemic effects. Malignant tumor are named according to embryonic cell of origin are ectodermal, endodermal, glandular, or epithelial. They use the suffix carcinoma. For example, pancreatic adenocarcinoma or squamous cell carcinoma. So, we also have mesodermal or connective tissue origin. It uses the suffix sarcoma. Example, fibrosarcoma, myosarcoma, angiosarcoma. So that means, pag nakita nyo sarcoma, that is a malignant tumor. Our Our body has defenses against tumor. We have the cellular immunity, the humoral immunity, and the natural killer cells. The cellular immunity is a protective immune process that involves the activations of phagocytes, antigen synthesized cytotoxic T cells, and release of cytokines and chemokines in response to antigen. While humoral immunity is also called your antibody-mediated immunity. With the assistance from helper T cells, the B cells will differentiate into plasma B cells that can produce antibodies against a specific antigen. The humoral immune system deals with antigens from pathogens that are freely circulating or outside the infected cells, while the natural killer cells are a type of immune cells that has granules or it has a small particles with enzymes that can kill tumor cells or cells infected with a virus. A natural killer cells is actually a type of white blood cells. Moving on to tumor staging and grading. So, naririnig natin yun kung anong stage, ano yung grade. So, grading refers to pathology classification of tumor cells. It defines the type of tissue from which the tumor originated and the degree to which the tumor cells retain the functional and histologic characteristics of the tissue of origin or differentiation. So we have grade 1, which means well differentiated, grade 2, moderately well differentiated, grade 3, poorly differentiated, grade 4, very poorly differentiated with high degree of malignancy. So when we say grading, it is actually a cellular, or it focuses on a cellular aspect. On the other hand, staging determines the size of the tumor, the existence of the local inversions, the lymph node involvement, and the distant metastasis. It is actually accomplished prior to treatment to provide baseline data for evaluating the outcomes of therapy, and of course, to maintain a systemic and consistent approach to ongoing diagnosis and treatment. So the treatment options and prognosis are based on the tumor stage and the grade. So may ginagamit po sa staging, which is known as the tumor nodes and metastasis, or the TNM system. The TNM system, or the TNM staging, provides categorization of the primary lesion and extent of involvement in the clinical assessment of cancer. T refers to primary tumor extent, while N refers to lymph node involvement, and M refers to metastasis. So those are the cancer classification according to staging. So stage 0, in situ. Stage 1, meaning limited to tissue of origin or localized pa lang siya. Stage 2, there is a limited local spread. While stage 3, there is an extensive local and regional spread. Stage 4, meaning it already metastasis or it involves other organs. Before ending this presentation, let me read to you these quotes from Jean Watson, who is an American nurse, a theorist, and a nursing professor. According to her, nurses are a unique kind. They have this insatiable need to care for others, which is both their greatest strength and fatal flaw. Diba? Tama naman. We care too much for our patient. I'm praying you will become the best nurses in the future. And this is my reference of this presentation. Thank you, everyone. God bless.